Welcome to another episode of Gray and I Slay. Today is going to be an awesome conversation. It is October, and we know that October is Breast Cancer Awareness Month. And I have a wonderful guest here with me, and I'm going to introduce her to you in just a few minutes. But right now, if you would just stop, take a moment, and just go hit that subscribe button, hit that like button, and hit that share button so we can let other people know about this podcast so they can hear this conversation as well. Again, we said it's Breast Cancer Awareness Month. And so we talk a lot of things in Gray and I Slay. We talk about aging, we talk about life, we talk about living, just anything that that directly affects us. And so breast cancer awareness in our community especially is a major, major topic. So we're going to get right to the point, and I'm going to introduce my guest, Jan-Cherie Crooks. And I'll let you tell people what you do, why you do, how did you get involved, and what you do.
Okay. I'm a radiologic technologist, and I work at a large hospital in their cancer section division of the hospital. And what that is really is someone who takes x-rays. When you have a radiology tech license, you can take x-rays of any body parts, but you can specialize in different areas. You can specialize in CT, MRI, bone density, radiation therapy treatment, cath lab, interventional radiology, and mammography. I specialize in interventional radiology and mammography, and so I currently am working in mammography as a radiology tech.
Okay. Well, tell me about little Jan growing up. Did you always want to do something in the medical field, or what were your aspirations as you were growing up? What were you planning to be?
So when I was little, I wanted to be three things. I said a pediatrician or a race car driver. It's true. Or an airline pilot. And actually my first bachelor's degree is in aviation. So I actually started out in aviation and was a pilot, but I didn't go to the commercial pilot level because it was just really expensive. And then just when I was in college, I, kind of was looking at my future and my life and really what I wanted out of it. Even though I loved flying, I was thinking about family life for my future and what that was going to look like. I wanted to have children, and I just didn't want to be gone. So that's why I ended up going into sort of the aviation management side of aviation and stopped flying.
Gotcha. I did not know that about you.
Yes. So, and I worked in aviation for many years, and I actually didn't get into healthcare until kind of later in life after I had children. And I sort of stumbled on it because I wanted to go back to graduate school to get my master's in education so that I could teach. So I went to work at a university so I could get the free tuition for the master's. And working at the university, though, I worked in the hospital. And so that's where I got really exposed to healthcare. And I saw all of the different options there. Growing up, I think I just thought when you worked in healthcare, you were a nurse or a doctor, and that was pretty much it. But working in the hospital, I got to see there's so many different support areas that support the nurses and the doctors. And really, there's so many different things that you can do in the hospital that the doctors really can't do what they do if there aren't all these other people doing what they do. So that's where I really got exposed. And I had a friend who was a radiology tech. She'd been trying to get me to do it, and I kept saying, no. I don't know why, but I just kept saying no till then. And then I thought, oh my goodness, that I want to do that.
I'm still tripping on the aviation. So do you keep up with your license?
I don't. I would like to, though. And even yesterday, my son said, you should fly again. And I said, I want to. When you go to college, I'm going to try to start back
again.
Yeah, because I still love flying and I still have a passion for aviation. So, but what's interesting is people think, well, how'd you get from aviation to healthcare?
Exactly.
Actually, when I really look at it, the strengths that I have that made me a good pilot are actually the exact strengths that I have that make me a good radiology tech.
Okay.
You know, you really have to pay close attention to detail.
Mm-hmm.
There are times where you have people's lives in your hands and you have to make quick
Yeah.
decisions
Mm.
based on that
Yes.
in order to maintain
Mm.
life. They're both can be high stress with kind of lots of pressure on you, and you have to remain calm within the pressure, and you can't panic in both.
Yeah, in
Really,
both,
in both.
yeah.
Otherwise, you can make a mistake that could
Mm.
injure, could hurt
Exactly.
someone. And so it's really the skills that I use there are really the same skills
Wow.
I'm using, just in a different way.
That's amazing.
Yeah.
Okay, so tell me what you do on a day-to-day basis as a radio. Okay, here I go again. I'm going to call you a doctor.
That's okay.
As a technologist.
Yes.
What do you do on a day? How do you? How does your day go?
So how my day goes, I really specialize in mammography. I specialize in breast biopsies and other breast procedures. But typically, sometimes I'll be doing screening mammograms on patients, which are screening mammograms are for patients who don't have any breast problems. They're just having their annual screening to check for any type of breast cancer or abnormalities. Then also I'll do diagnostic mammograms for patients who maybe are having a breast problem, or maybe there was something that the radiologist, who's the doctor who reads the mammograms, if there was something that they saw on their mammogram that they want to investigate and kind of dive further to see if, if they want to do a biopsy, if they think there's an area of concern. And then also I do diagnostic mammograms. And then I also work directly with the radiologist, who's the doctor, and help them with the breast biopsy procedures. So I do breast biopsy procedures as well.
Okay, so are you the first person? So after you do the mammogram, the scans and everything, are you was someone in your field? Are you guys the first one who actually sees if there's like a mass, or are you the one who sees the outcome of the mammogram, and then you pass it on to the oncologist or to the radiologist? So what actually happens after the mammogram?
So after the mammogram, actually, when we're taking your images, we do see.
Oh, you see right
we
then.
see what the radiologist, who's the one who's going to read the mammogram, and really see if they think there's an issue or a problem. We're the first ones to see that.
Okay.
However, sometimes there can be a very obvious cancer and you can tell immediately that there is something, but majority of times there isn't. And so the radiologist is the one who is really trained to detect these things. There could be some really subtle, very subtle, hard to see abnormalities that only the radiologist can see. And so a lot of times when we take the images, the patient will say, "Do you see something?" And I mean, sometimes the answer could be yes, but I really can't say with any certainty. It's just not within our scope of practice. We're not permitted to say, yes, I see something, or no, I don't see something. Because the honest truth is there could be something that's there that we just don't see because we're not trained
to really see it.
Yeah, to really see it. And that is what the radiologist, who's the physician, that's what they do.
Okay.
So that's, their role. But then, so after the mammogram, we do send the images to the radiologist and they look through those to see if there's anything that they're concerned about. If there's anything that they're concerned about, they will request that the patient come back to get some additional imaging. So that's when they'll come back and we'll do a diagnostic mammogram. And the diagnostic mammogram, we're really focusing on what a specific area that the radiologist sees. Sometimes it's a mass that they see. Sometimes it could be a very, very early stage of breast cancer, which is sometimes calcifications within the breast. They're just little tiny white dots on the imaging that are difficult to see. So they'll call the patient back so we magnify those little dots and do some magnification images so they can see it better. Sometimes they're benign. A lot of times they're benign. But sometimes when they do the additional images, then they're able to see, oh yeah, that's benign, I'm not concerned. Or sometimes when we do the additional images, they're able to say, this is suspicious, I'm still not sure. And so if they're not certain, then they might recommend biopsy, or they might, if they think it's probably benign, they might have you come back in a few months to check to see if there's any change within that structure, those calcifications. But if they're really not sure and they want a biopsy, they'll recommend a biopsy.
Yeah.
Because some people say, well, why do you say probably benign and have me come back? If you think it's worrisome, I want a biopsy now.
Yeah.
If they think it's worrisome, they'll do a biopsy now.
Okay.
They really will. But if they think it's probably benign, they may be concerned about it, may not be. And if it was something concerning, typically they wouldn't send you away unless they thought that it's something so slow that I don't even really know if this is developing into something or not. So they'll give it some time to see if it is or if it just stays the same.
Okay.
Yeah, but sometimes people think that when you have a mammogram, well, last year's mammogram was fine. Well, how come all of a sudden this year there's something? Actually, there's changes occurring within your body all the time. Even though you had a mammogram last year or last week, in a month, things could be different.
Exactly.
You know, so
especially if you self-breast check.
yeah, so that's why they encourage, because people say, well, I had a mammogram, like, there shouldn't be anything there. Why would I still need to do a breast exam?
Yeah.
Things change. So that's why we do encourage people to do your regular self-breast exams, because there may not have been something when you had your mammogram, but maybe something's developed and you might be the first one to notice that.
Right.
So, yeah.
Okay, so what do you just kind of like calm people's nerves? Because when they think about going to get a mammogram, I know for me too, at this big age that I am, it's like, oh my God.
Yes.
But what do you suggest to help us, especially somebody who's doing it for the first time?
Yes.
What do you suggest as far as like calming nerves to make it just go as seamless as possible? What things do you suggest to a person to be prepared for their exam?
I would say definitely one thing is don't skip your breakfast if you normally have it.
Okay.
Some people think that, oh, maybe I shouldn't eat because I'm having this done. But some patients have a reaction to the mammogram. The body's response to it's a vasovagal response is what we call it, where the body gets stressed.
Okay.
And then it just sort of wants to shut itself down. So sometimes when patients have a mammogram, sometimes they start feeling a little ill. Sometimes they feel like they need to sit down. Sometimes they faint. And sometimes it's because the body's reaction. But if you've eaten and had something to drink that morning, sometimes that doesn't happen as a result. So I say eat your breakfast, drink your juice, whatever you normally do. Whatever you normally
eat fast for 24 hours.
No, don't do that. No fasting. We're not doing any blood work. So please eat, and so you can be comfortable, so your body can be ready.
Yes.
But also for the nerves, I understand it. The one thing I will say, I think people get nervous sometimes because they're nervous that what if there is something? And the one thing I would say about that is if there is something, the good news would be that this would be early detection.
Yes.
The earlier we can detect something, the more options we have for your treatment.
Yes.
I think fear keeps people away, fear of what if I have breast cancer? And then also too, the fear of you don't know, well, what happens after you have it? Like sometimes people think it's an automatic death sentence, like you're going to die because you have it. And that's just not a typical case.
Exactly.
And so I would say the earlier people just continue getting your routine screenings. And if you notice something that's different or you're not sure about something that's different with your breast, call your doctor and get some guidance on what to do next. Because the earlier we get a diagnosis, if there is one, the more treatment options, which means the longer you can live, the more time you can have with your family. Or a lot of breast cancers, the very early stage ones, they are easily and quickly taken care of. And with surgery or sometimes radiation, there are a lot of different treatment options. And people go on to live long, healthy, happy lives.
Exactly.
So,
okay, you mentioned seeing differences in your breast.
Yes.
What did you mean by that? Seeing like nipple changes or just, what do you mean?
So some differences are when you do your breast self-exams, if you notice a lump, that's kind of one of the ones everyone talks about. But there's some other things that people don't realize. And one thing is when you part of your breast exam should also involve looking at your breast in the mirror. So looking at your breast in the bathroom and kind of checking from different angles just to see does does the skin sort of look smooth? You don't notice any areas of what we call dimpling, which is the skin maybe pulling in towards itself.
Okay.
So
Okay.
maybe, if you notice any dimpling, or if you do this regularly and you've never seen dimpling and now all of a sudden you're
You see
seeing
it.
dimpling,
Mm-hmm.
that's something you'll want to call your doctor for. Also, you mentioned nipple changes. If you notice redness or scaliness from your nipples or any nipple discharge, you should definitely call your doctor for follow-up. Also, let's see, if you notice your nipples, all nipples are different.
Yeah.
Some stick out, some are flat, some pull in towards the breast. Now, so you have to know what's normal for your nipples.
Exactly.
Now, if something changes with your nipples, if your nipples have always stuck out, but now you've noticed that one is pulling in or both are kind of pulling in towards your breast, that's something you want to have the doctor check out, because sometimes that can be an early stage of a cancer. Also, there's some breast cancers that strictly involve the nipple, so that's why I mentioned the redness, scaliness, itching. That there's breast cancer called peau orange, which is specifically at the nipple. So you want to notice any things like that, even if you think, well, I think it's fine. I don't think it's a big deal. If you notice that it's different for you, you should definitely call your doctor.
Yeah, like for me, when I work out and I do like some lifting or whatever, they get sore.
Yes.
And I'm thinking, okay, because when we were younger, when we had our menstrual cycles, whatever, and they begin to come on, they would get sore, right?
Yes.
So I'm way past that. But like I said, when I work out, doing push-ups, pull-ups, lifting weights or whatever, I tend to see sometimes the tendency is to get sore.
Yes.
And so I always judge that to see how long is it lasting. Okay, if it's lasting more than like a week or whatever, I'm thinking, okay, maybe I should just go get this checked out. So it's something like that, like soreness. Is that something that I should take into account before I call my doctor to set up an appointment, or is that something that's just normal that happens?
It does happen, soreness. You can have muscular soreness, like you mentioned. Also, with menstrual cycles, breasts can be more tender or sore at different times of the month. Even postmenopausal women can have breast tenderness still, because some people say, well, I'm postmenopausal, my breasts shouldn't be hurting, but it can still happen because you still do have some hormones in your body even though you are postmenopausal. So hormones can cause pain and soreness. So sometimes it could be normal, but I would say if you're not certain, you should just call your doctor and let them kind of guide you with that. If you notice a pattern with your pain, if it's what we call diffuse pain, which is just sort of not in any particular one area, or it could be in different areas, different times, or you notice it at a certain time of the month, there's a chance that might be, hormonal, but I would still say to contact your doctor if you're still concerned about it. Yeah. If you have pain that's in one particular area, whether it's constant or intermittent, if it's always in that one area, I would say to definitely call your doctor and just see what they want you to do from there. Okay. Breast cancer typically is not painful. But I will say, don't say just because you have pain, don't say, well, breast cancer is not painful, so it's fine. I would still call your doctor and let your doctor tell you, what they think you should do. But typically breast cancer is not painful unless you've let it go to an advanced stage. I have seen patients who have had untreated breast cancers that end up turning painful because it's been growing and developing, and there are a lot of other physiological effects taking place as a result of that cancer that caused the pain. But
awesome. So what did you say to, like I said, we talked about what to say to somebody who's going for the first time, but what about men? Is there like a high number, a high statistic of breast cancer in men? Have you seen that?
I have seen breast cancer in men. It's a lower number than breast cancer in women, which is why men typically don't have mammograms. However, if you, just like women, if you notice any changes in your as you in your chest area as a man, that you should definitely call your doctor, because men do have breast tissue. You just don't have a lot because of the levels of estrogen and progesterone versus testosterone. So you don't have a lot of breast tissue, but you do. So there's always a chance that you can develop. If there's breast tissue, there's a chance that you could develop breast cancer. But men will typically notice like a lump or sometimes like soreness or pain, but also same symptoms as women. If you notice things are changing, or things changes in the nipple, or changes in the skin, or any nipple retraction or skin dimpling, or any discharge from the nipples, even as a male, you should contact your doctor and find out what they want you to do from there. Yeah. And typically what the doctor will want is usually maybe a mammogram or ultrasound. Because typically if you have a lump in your breast, or they'll usually want to order an ultrasound as well. If you have pain that's in one particular area, they'll order ultrasound. Or sometimes when the radiologist calls you back from a screening mammogram to do a diagnostic, sometimes they'll order ultrasound in conjunction with mammogram images.
Okay.
Yeah.
So you're not the one who gives the news to the patient. Correct.
If they have breast cancer.
Yes. So that's not your job.
That's correct.
Okay.
That will usually come from, if you've had a breast biopsy, usually the practitioner who ordered your breast biopsy will usually contact you to notify you of breast cancer.
I know you said you work. I know who you work for. Big hospital, and you can't say the name.
I can, yes.
Okay. So the James,
yes,
at the Ohio State University,
yes,
in Ohio, which is known for. Is that one of the biggest cancers? Is it breast, or is this? It's just you guys do a lot, cover mostly all cancers.
Yeah, we cover it all for sure. But breast cancer is. A lot of women have breast cancer, so it is one of the larger ones, especially for certain populations like Black women. Yeah, it's a big one.
That's one of my next question. Minorities. Okay.
Yes.
So that is, the statistics are very high for Black and brown.
It is, yes. And that's one of the reasons why I like to talk about breast cancer, is because I think in some of those communities there is a fear of health professionals for different reasons. People in the Black community have a fear of going to the doctor or looking into something. I think we pass things up a lot and push it off a lot. And then also too, I think just with history in the United States for how some Black people have been treated in the healthcare system, and different tests being done on Black people in like the 30s, and like the Tuskegee, experiment and things like that. There's a distrust.
Talk about it, girl.
There's a distrust.
Yes.
And so that things like that, the distrust and fear, sometimes it holds people back from really getting the care that they need. Even preventative care, it holds them back. And so that's why I like to talk about it. And that's why I like for people to see me and hear from me, because I've heard it from my patients. They tell me that they sometimes they're happy to see me, that they feel like there's a connection, or maybe someone who understands, or someone that maybe you can trust, even if it's something that seems to be as little as skin color. Sometimes that breaks down a barrier people feel like they can maybe trust you a little bit more because of things that have happened in the past. So this is one of the reasons I think why I do this, is because I want to sort of break down that barrier and encourage people to get the care that they need, because there's no sense in dying from something like breast cancer when a lot of times it is treatable.
Oh, let me chew on that for a second. That's real good. So how long have you been in this business?
I have been in breast specific for 7 years.
7 years. Okay.
Yes, and I've been in radiology imaging for, I think, about 11 to 12 years now. Yes.
So have you developed like close relationships with some of your patients because of your skin color? skin to skin. So
I think I have, not me specifically trying to, but I think people are, everyone has their own experience with healthcare professionals, and based on what their experience is, everyone's looking for something in particular when they're looking for someone to care for them. And sometimes there's just people are looking for a familiarity, or someone who they think might understand them because maybe we've been through some same things, or maybe, we've had some similar background, because, and sometimes it's because of skin color. And so they feel like, oh, you might understand, or maybe I can trust you, or whatever it is that helps you to trust us to come and get your care. I'm all for it.
Yeah.
Yes. And
so what about like insurance? Do you guys turn people away who may be at a disadvantage because they don't have the health care, or what's in place for people who, I mean, you have breast cancer, but you have no means of, paying for it.
Yes.
What happens?
We have so many programs to assist people for all sorts of different care that they need.
Please. Say again. You have what?
We have so many programs to assist people with all needs. I mean, I'm not even just talking about healthcare needs. We have programs to even assist with transportation. Like if you can't get to your appointment, or you can't get to your radiation treatment, or, you can't get to your chemo. We have
awesome
programs even to just get a ride to get there, which some people, things like that are holding them back. They don't have a way to get there. Also, we have programs to help pay. We have programs to help pay for screening mammograms. We have programs to help pay for patients' treatment. And not just us, but a lot of healthcare systems do. I worked next to someone in our financial assistance program many years ago. And I remember her telling me that there's so much money sitting that they don't have anyone to give it to because no one has asked. No one has come. And I've heard people say, well, I can't have that diagnostic mammogram because I can't afford that. But the thing is, if you ask, we have programs to help. Okay. We really do.
Okay.
And people also say, well, I think I'm going to make too much money to even qualify. I can't afford to have it done, but I think because of how much I make, I'm not even going to qualify. Some of our programs are not even based on need, or the money is the minimum qualification is not the typical what you would think if you were going to apply for like public assistance or something like that. The threshold is a lot higher. So I would just encourage people, if you can't afford it, to just call the financial assistance number on the back of the bill. They can help you and guide you and look into it to see what do we have that we can offer. And they're not just us, lots of programs in the community, lots of other organizations that help with all the things that patients need to make it through their care. So it's not just a one facility, one organization thing, like just ours. A lot of them do. Yeah.
Okay. I love that. And I just like it. I love that.
I do too. I don't, because I've heard people say it all the time, and I try to encourage them, please just call this number and see what we have, see what we can do to help you. Don't let that hold you back. The fact that you don't have insurance and you can't pay, please don't let that hold you back from getting your care. Because we have programs in place to help you.
Okay. Yeah. So what has been satisfying for you in this role? Can you talk about something?
Well, I think one of the things is just being there for someone however they need you to be there. Sometimes it's like the clinical care I'm providing. Sometimes it's emotional care during a procedure. Sometimes it's emotional care during a biopsy. Sometimes, I feel like just whatever care the patient has needed, just kind of being able to provide it and just kind of seeing how that's affected that person's life, or even just affected them in the moment that they
Yeah.
need, that they received what it was that they needed at that moment.
Okay.
Even if it was just some encouragement, or, I think that has been what that's one of the things of what I do that I enjoy the most.
Yeah.
Also, I really enjoy the educating, when I enjoy educating
Oh,
people
wow. Oh my goodness, Jan, I love that. Yes.
about their
Yes,
health,
about their health. Right.
and also to, just kind of educating on options. I remember when I was young, I was kind of more of a closed-minded, like sort of single-minded, single mind track
Yeah.
of in my thought process. And
Mm-hmm.
just as I aged, I realized, oh my gosh, there are
Open.
options in the world,
Yes.
period. Even not doing anything, that's an
Mm-hmm.
option,
Mm-hmm.
And so I just didn't realize, and I like to encourage people to kind of like speak up or ask for help,
Yeah.
and because there's so many different things that could be done, and
Mm-hmm.
sometimes when you ask for help, you get more than one mind involved,
Mm-hmm.
and the more minds involved, you can come up with even
Yes.
more options,
Mm-hmm.
and even for patients who've been diagnosed with breast cancer, I mean, that's what your treatment team is doing, is
Mm-hmm.
coming up with the different options, and they are options, and you're the one really who you're part of the treatment team. I want people
Yeah.
to realize too,
That's
because
true.
I think sometimes people think, well, all these doctors, and and they're the smart ones, and I don't know, and
Mm-hmm.
and yes, they are educated and they're very good at what they do, but you're part of the team too, and
Yeah.
so
You
you
know
get
your
to
body better.
yes, and you
Yeah.
get to contribute as well, and if
Mm-hmm.
there's something that that they want to do, or you don't want to do, or you're not sure if that works for you, I encourage people to get a second opinion.
Mm-hmm.
If you can, go to another facility and get a second opinion and see,
Yeah.
because all doctors are not created equal, and some might be better than others, or some, they might have other ideas, and one idea might work better for you than the other idea that you heard, or
Mm-hmm.
might work out better for your life. Or so I just encourage people to, let's talk and speak up and ask for help, and
Yeah.
and if you don't get the answer you were looking for, it doesn't seem right, you don't feel right about it, get another
Yeah.
opinion.
That's awesome.
Yeah.
So, how do you get those opportunities to talk to patients about being educated, becoming educated about their health? I mean,
Mhm.
how does that happen when they're sitting with you one on one, or?
It a lot of times it starts with when I'm caring for them, either during their mammogram or during their
I
biopsy.
love that.
It happens a lot because there's a lot of talking that we have to do during procedures, and things come out, or patients will mention one particular thing, or they'll mention a particular concern. And so that just sort of opens the door for us to start talking about some of those concerns, or
Mm-hmm.
that they have. So just our interactions, and then also to we have opportunities to speak out in public,
That's what
or
I was getting ready to ask
do
you. Yeah.
things like your
Yeah.
podcast, and speak on different panels, and
Mm-hmm.
just trying to just get out there to just talk to people.
Yeah.
Those are some other ways too
Yeah.
where I've been able to.
Because I know that's where I met you. Back in
Yes.
the summer, we were on a panel together. So,
Yes.
so how did that come about? How did the lady? I can't remember her name. John, you can not block that out. I can't remember her name at the time.
Yeah.
But so, how does she find you?
So she found me because I was speaking on another
Oh, so that's how
panel.
she found you.
That's how she found me. She
Okay.
was in the audience of a panel that I was speaking on, and then afterwards she came up and we were talking, and she said she had an event coming up and she was going to have a panel discussion. She wanted to speak on her panel, and that panel that she saw me on, how that happened was from a patient who I cared
Oh.
for. She worked at a community cancer organization, and she was putting a panel together. She was just talking about her experience, with her mammograms in the past, and she was putting a panel together, and she asked me to speak on her panel. So, that's why I really think we have to open up. I feel like in the past, especially, I know when I was younger, there were certain things you didn't talk about.
Yeah.
Well, and nobody talked about it. My parents weren't talking about it, so I wasn't talking
No,
about anything. So you
exactly.
just thought, well, that's what you do. But I love how we're talking more about life in
Yes,
general, and we're
exactly.
talking more about problems and successes and failures, and because I feel like others can
Hmm.
learn and
Yeah,
grow.
this new generation, I tell you,
Yes.
they're not sleepers like
Not at
the
all.
older past generations, not at
Yes,
all.
and I
So I
love
love it
it. I
too.
love it too. I think
Yeah.
it creates an atmosphere of for us to thrive,
Hmm.
And
Hmm.
so I love it.
Yeah, I
Yeah.
love that. So how many panel do you do a year? I mean, are you going speaking, or do you have a set number that you pursue a year, or they just happen?
I don't. They're they've just been happening organically, but it's something that I'm looking deeper into
Yeah,
to
get out there more.
get
Yeah,
out there
because I know when
more.
I heard you, well, when I was questioning you, since I was the moderator,
Yes.
and I was like, oh yeah, I'm going to ask her as soon as this is over. And I said October. That's what I said. October's
Oh,
a breast cancer awareness month, so I want you
yes.
to come on.
Yeah.
So
And
yeah,
thank you so much for having me. I
absolutely.
really
Yeah, because
enjoy the
this
opportunity
is
to
very
do this.
important, not only to our community.
Yes.
I mean, to everybody. This
Yes.
is very important topic. Because I just want.
Absolutely.
I mean, breast cancer is just like every time you turn around, it's like somebody's getting a diagnosis,
Exactly.
or it's to the point to where somebody just passed away from it, and it's
Hmm.
like this is just it's too much.
Yes.
Yeah.
Yes. That is true. It
So
is.
what do you do for your emotional health? Do you, um, I mean, even in this field that you're in, what do you
Mhm.
do? How do you take care of yourself?
I a couple different things. I try to eat well. I do. And I'm getting more and more successful at it. But sometimes, I'm not the best. But I exercise.
Okay.
I do. I lift weights. I do cardio. Cardio is not my favorite, but the weightlifting I absolutely love. And
Hmm.
the gym is almost my quiet space. It
Okay.
is. I don't listen to music at the gym because I sort of tune in to me at
Okay.
the gym.
Yeah.
Especially with lifting, because with lifting, I find you have to breathe a certain way, a certain times you inhale, certain times you
Yes.
exhale. You need good posture, not just good posture, but you need to be at a certain stance depending on what type of lifting you're doing to not injure other parts of your body. So
Hmm.
you really have to focus.
Yeah.
And I also find like when I lift, I look in the mirror too, because I'm checking my posture and my stance to make sure
Yes.
that I'm not injuring, a particular area of my body. And
Hmm.
so I really find like I'm busy hustling, bustling, all day at work, and you come home, dinner and hustle and bustling, this appointment, that appointment. The gym is like the time where there's nothing to do
Yeah.
but to
To
focus
for
on
you.
me.
Yeah.
And so that is my space. Like even when I have to miss, if I have something going on, I don't feel so good.
Hmm.
Not because oh, I didn't get my workout in. It's more because I didn't like get to feel the physical effects of my workout. I didn't get to tune into myself
Hmm.
because I missed my workout. So
Yeah.
yeah, exercising really helps me. Also too, I'm close to family, and I have a few really close friends. And so I kind of, keep a core group of people around me
Yeah.
that I think
That's
help
beautiful.
with emotional support as well. And so I think those are the main ways that I care for
Okay.
myself. I kind of just recently dove into some hobbies that I didn't really realize I had, like reading. I really enjoy reading.
Hmm.
Um, and so, yeah, that's what I do for
Yeah. That's
to
good.
support myself.
I love that. So
Yeah.
no therapist, anything like
Well,
that,
I
or
have in the past. I
okay.
have. And honestly, I probably need to dip back
Hmm.
in because I think sometimes especially when you care for others,
Hmm.
you give out a lot.
Yes.
You give out a
Yeah.
lot.
I
And
mean,
sometimes there's not
you're
a
always
lot.
you're pouring. You are you're constully pouring into somebody
Yes.
else. Yes.
Yes. And I
And
don't
who
even
pours
just
back into you?
exactly. And I don't
Yeah.
even just mean like just healthcare giving. Yes, you
Yeah.
give a lot there, but even,
Yeah.
in your home as a wife or a
Yes.
mother, or, maybe if you're caring for someone at home
Yeah.
who has a disability, you're always giving. You have to find other ways to pour back in. And so I think I probably need, even though I have these other avenues that I like my lifting and reading, and I think I probably need to do a touch base with therapy, just to make sure that I'm continuing to stay in a good space. But I have in the past, definitely. And I love how everybody's talking about the fact that they go to therapy, because
exactly.
I think people used to hide
Right.
or not go
Especially
at all.
they say in our community.
Yes.
No.
Yes.
Black people don't go to therapy. It's like, what?
Yes.
Nowadays, it's Jesus and therapy.
Yes. But you walk around with all this weight,
Yes.
and you don't speak about it. So because you don't speak about it, you're holding on to it, and it's stressful. And you I think it needs to be relieved. Okay.
Okay, so you mentioned children.
Yes.
How many children do you have?
I have one son.
You have one son.
Yes,
Okay.
a 16-year-old.
Oh, he's 16.
Yeah.
Okay. So you have to guide him a couple of more years before he's out in college.
And we've been doing college visits, actually, and we had one last week, and so I'm learning a lot about him and myself too in the college visit. It's interesting. So, but a lot of guidance for the kiddos,
And it never goes away.
that's what everybody says.
It never stops.
Darn it.
My
Everybody's
son he's married, but he'll call me when something's going on. He still comes to me, which I like, wow, you still checking with your mom? But he still calls me and wants my advice, wants my opinion on things that he's thinking about doing, which
That's
makes me, I'm like, wow, this makes me feel great that he still respects and wants me. Because growing up, I thought he was like tuning me out. And I think he was listening, but not listening. I hear you, but I don't hear you. But now it's just like, this is awesome.
Yes.
Yeah.
And sometimes with the boys, I feel like you think they're not hearing you, but they're picking up some of the things you're saying, even though you feel like you've been ignored and no response. They're picking up some of those things. Yeah. So I think it's so important to keep talking, keep doing what you do, trying to raise them, because some of those things that later on, you'll see they'll come back to you.
Exactly.
Yeah.
Awesome. I love this. This has been really good, Jan. I'm so glad that you were available to come on today. And
Thank you for having
so do you have any closing thoughts, or do you have any words of wisdom that you want to share with the audience about breast cancer or any cancer?
Just really that breast cancer oftentimes is very treatable. Don't let fear of having cancer hold you back from getting your screenings. Don't let it hold you back from investigating if you're having a breast problem. Just kind of move right forward into it. And I know even if you were to get a breast cancer diagnosis, it's scary, it's confusing, you feel overwhelmed, and you don't know what to do, but your providers will walk you through it. They will get you to where you need to be. It's not something that you have to figure out all on your own. You'll have a team who will help you to get where you need to be and treat it so that you can move on and do the next thing in your life that you're looking forward to doing. Also, one thing that I just really want to do, because when we talked about patients want to see someone that they connect with, or want to see someone who maybe looks like them so that they can feel that they can trust them. I remember when I was in high school, I just didn't realize there were all these things that you could do, all these professions. And I just really want to encourage youth to especially minority youth. We need you, and I think sometimes money holds people back. You think, well, I can't go to college, or I can't afford medical school. There are a lot of programs for you to try to help you get those scholarships. Or even if you think, well, my grades aren't good enough, there could be some grants for you that you qualify to get your education. So, you can get through medical school, and you think all these years of residency, no, just come on. We need you. people need you. So
Yeah.
I would love to encourage more minorities to get into healthcare. You
Yeah.
know, patients are out here not getting procedures or not getting screenings done because they're not comfortable because they don't see anybody who looks like them. So I would love to see more young people, especially young people of color or just women, everybody really come. We need your help.
Yeah, we need you.
Yes.
People need to see and hear more from you and others that look like you, because
Yes.
what you just dropped in the last few seconds, it's amazing that young people who think that they can't afford it or don't qualify, and what you just dropped for them to let them know, hey, it's out there,
Yeah.
assistance is there,
Yes.
and they
It's
need
there.
to hear that.
Yeah. People, the thing is, they don't just walk around telling you about the assistance or
No.
waving it on a flag like, hey, we've got this over here. You know, it does require you to, like we said, talk, ask somebody, ask for help. And, you know, even if the person who doesn't ask doesn't know, at least maybe that's someone who you could try to get you in the next direction. But I would just say, don't let any doors, closed doors that seem like they're closed, don't let those stop you from trying to push forward, pushing through. And I feel that relates to you know, having a cancer diagnosis or even just getting a screening. Don't let any doors or fears or barriers keep you out. I would say, as long as you're alive and breathing, that's what I tell my son, you're alive and breathing, like, you keep pushing through. Try to push through.
That's right.
You know, if you can try. Yeah.
Yeah. And what would you say to a support system, someone's support team? How would you encourage them to keep pushing, to keep going?
Oh, yes.
Even when it's like, I know someone right now who she's in the final days. And so what do you say? I'm not the support system, but I know some of her support system. So what can I say to her support team just to keep them going?
Yeah.
For her.
I would say, as people who support others, sometimes you kind of neglect yourself a little bit. I would say to continue supporting, but don't neglect what you need to.
That's
so
good.
Whatever that is, whatever that looks like if you mentioned about the final days, I mean, I would assume, you know, maybe you're going every single day to be with them, but you need some things too. So if you feel like maybe there's a day that you can't go, I just need this day to myself and I can't go, it's okay, because you can't support if you are not caring for yourself.
That is so good.
So I would say for someone who's supporting people in any aspect of life to also don't forget to care about you, support you too. Yeah.
Jen, you got to come back.
Oh, I wish.
So good. And what was I visualizing? Me and you, like at a school. That may have to happen.
I am not.
Talking to kids.
I have to be honest, the school thing has been on my mind for years. Ever since I got into what I do, because I thought, well, because everywhere I would go, I was the only one who did what I did, the only one who looked like me. And I was like, well, where is everyone? I didn't realize they're not here. And I thought, well, why aren't they here? And I thought, well, does nobody know? And I thought, well, I didn't know. So they probably don't know either. I stumbled into this. So the school thing has been on my mind for 12 years. It's time.
I just saw it. I'm like, oh my God.
It's time for me to move. Yeah, because I've thought about it for, years. And I think the reason we're underrepresented in healthcare too, because I feel like kids don't realize you can do it.
You can do this.
And you haven't seen someone who does it, so you don't realize it's an option. Then with somebody who looks like you think, oh my gosh, she did it, I can do it.
Exactly.
Yes. So yes, the school thing is on my agenda.
Okay. All right, girl. You got to make it happen, girl.
Look, and I said it out loud, so now it's
you
really
said it's out there now.
It's
you
really
gotta make it happen.
Yeah.
Oh, I'm so glad you were available. And again, yeah, you got to come back.
Oh,
You
definitely. I
have to
definitely
have you back.
will.
Yeah,
Thank you
I
for
just love your
having
spirit.
me.
I mean, I love your spirit. I
Oh,
love the
thank
way you
you.
just, how you relay and just talk and just, it's a conversation. It was a conversation more
Yes.
so than an interview. It was more a conversation.
Yes, yes, it was
Yeah,
very
very
nice.
pleasant. But again, thank you guys for joining us. And don't forget to subscribe, like, and share. And also remember that Gray and I Slay, we are a multi-generational. That means that it's like we just talked about, we're going to bring in kids, we're going to bring in younger people, just so that because they need us as much as we need them, because we do need them.
Yes,
Yeah,
absolutely.
we need the younger people. And you guys need us too. And don't forget about www.grayandIslay.com, which is our online store. We have merchandise out there. Go check it out. See what you might like out there. We also will be updating soon with our Black Friday merch. It's coming. I just gave my approval, so that'll be uploading soon. So stay tuned. But go out there and check us out. We greatly appreciate it. And don't forget to subscribe. That would help us to make our audience larger, so more people will hear about us, hear about Gray and I Slay. So we appreciate you guys for tuning in, and we will be talking to you very soon. Thank you. Thank you, Jan.
Thank you.